Hello everyone and welcome. This is Michaela Conley, HP CareerNet, and today is the next in the series of Koop Award, or the Koop Award winner series. Today we have Medical Mutual of Ohio's award-winning wellness program with Connie Butel. Medical Mutual of Ohio is a recipient of the C. Everett Koop Award. Medical Mutual will present their strategies and initiatives along with data analysis and program impact on changes in healthcare costs, short-term disability, lost work days, and risk status. Connie Butel is the Supervisor of Health and Wellness. Connie has over 20 years of experience in comprehensive health promotion and health management strategies for corporations as well as community settings. Since joining Medical Mutual in 2006, she has assisted in the development of Medical Mutual's award-winning Everett Koop National Health Award, National Business Group on Health Best Employers for Healthy Lifestyle, American Heart Association Fit Friendly Companies Platinum Award, Healthy 50, program design and generated sustained employee engagement and impact on health costs, productivity, and the corporate culture. Connie, I'm so glad you're here today. The floor is yours.
Okay, thank you so much, and thank you everyone for joining me today. I know how busy everyone's schedules are these days, so I really appreciate you being with us today to hear our story on what we did to win the Koop Award and pretty much the data we presented and the information on our program. So we were a recipient of the Koop Award last year in 2010 for the data we submitted. Some of the data has changed. We've had updates, so this presentation today includes our most recent rounds of data that we have available. It's all been pretty consistent since we won the Koop Award, so there haven't been any major changes in our results, but I just want to let you know that when we won the Koop Award, the data may have been a little bit different. It was a year earlier in the data pool. But today what I'd like to explain is pretty much who we are, what we did, what programs we implemented, and then kind of this is what we got from it. These were the outcomes we received, because I think when we attend conferences and we want to learn more about what other programs have done, you pretty much want to say just cut to the chase and tell us what you did, what programs have you implemented, are employees participating, and really what did you get from what you implemented. So that's my goal today, to recap for you who we are, what we've done, and what we got from it. So in telling you a little bit about who we are, no different than most companies, we wanted to start out putting pen to paper purposefully to come up with a purpose and some mission and vision statements. So again, unlike a lot of other companies, we want to improve the health and productivity of our employee population and impact their well-being. We developed a pretty comprehensive operating plan that we work from, and I think that was an important step for us to sit down and map things out, again, in a more formalized structure. I think really assisted our efforts. Our employee program, when we sat down to strategically develop, we wanted to strive for an integrated program. So again, we want to keep sight of keeping our healthy employees healthy. We adhere to the belief that you have to keep those employees where they are. You have to meet employees at all the stages across the continuum. Don't ignore those healthy ones. We all know, they kind of transition into your high-cost, high-risk employees later on. It was important for us in the third bullet point to impact our healthcare costs and trend. And we really have a focus on our corporate culture. That to me in the research is a key point now. A lot of organizations and a lot of the research is being directed at how the culture influences the success of the programs. I will tell you now that our programs are not housed in our HR department. We, by design, house them in what we call our care management area, so the wellness team is located in our care management area, not in HR. And I hear a lot of feedback over the years that some companies look to see if they should move that from the HR area. You know, is there a stigma when the wellness programs are associated and rooted in the HR department? So ours are not. Our employee program started, as most programs do, with a more, what we like to refer to as a morale-oriented model. It moved from that basic awareness and morale type of program into a mature, more results-oriented program. So I'd like to talk about that. We moved this more to what we refer as the health and productivity model. Like I said, most programs start out as a morale-oriented, very simple programs, fun engagement for the employees. Usually you kind of step it up to an activity-oriented model so that you're looking at you know, some evaluation, but not much. Is it voluntary? Is it site-based? Some risk reduction programs designed into it, and then you move that then into your, you know, true results-based model as we did. So in our more results-oriented health and productivity management model, we look at the incentive structure. Are we looking truly at risk reduction? Do we require some activities? Is it both on-site and some virtual programming? Is it designed to be more personal for the participant? And then key in all of it is the evaluation and the metrics. So again, our program matured from moving from one model to another. A little bit about our demographics. With around 2,700 employees in 15 sites, mostly in the state of Ohio, and we are located in other states. It's important for us to be equitable in our programming across all sites, which is difficult, but we do our best. Some of our sites are very small. Our two largest sites are here in Ohio. We're headquartered in Cleveland. Our other Toledo location is one of our larger ones. So there are some things that we can do based on economies of scale in Cleveland and Toledo that we can't do at the other sites, but for the most part we really try to be fair and equitable because we hear a lot of feedback on that. So again, 75% female, 25% male. You'll see in our employee age breakdown, the majority, you know, a third are in the 40 to 49-year-old range and another third in the 50 to 59-year-old range. And then I don't know if you can see my cursor, but here we like to call these our employees that still think they're quite invincible and not so much worried about what their cholesterol level is or their blood pressure until they start moving in here and move into that range where they're seeing the risk go up in the no longer in the optimal ranges. This slide and the following slide, they're busy slides, but I wanted to give you an idea of the progression and the build and the evolution of our program. So back in 2003, we really started a full implementation of our program. We took a formal proposal upstairs, so to speak, and got it approved by the executive team to make a more formal structure to our program. Back in 2003 is when we implemented and asked employees to do the first health assessment. So you can see as the years go on, we add to the program. There's not every so often we'll take something out, but we kind of keep building upon what we've established. And truly our program started with a group of employees wanting to walk at lunchtime. That turned into a more formal walking program. We started some on-site Weight Watchers programs. And really it started at a very basic level, and we are not so concerned about we were never concerned about adding a large volume of programs to overwhelm the employees. We wanted to create a slow build. So some of these are not exactly programs, but you know, some of the ideas that we've implemented and set into our structure. So you can see, again, it looks busy, but if you can review it a little bit, you'll see what we've implemented and how we continue to build over the years. This slide, I think, really is the one that's most important and the one that everyone wants to see. And I've included in the boxes the point values for the programs that we implement. We do have a point system here. That point system has worked well for us because it really allows us to weigh the programs that we want the employees to participate in, and the ones that we feel are the most important and the most value. So you'll see in the health promotion box over to the left, our health assessment really is our top point getter at 400 points. Our health assessment is the gateway program for our employees. If you do not complete the health assessment, you cannot earn any points in our program. So we want that data. We want them to participate in the health assessment, so that's why we've designed the gatekeeper model. You'll see another top point getter is our on-site health screenings. We want employees to come to those screenings regardless of whether they've seen their healthcare providers for an annual visit. We want them to come to our annual screenings and participate. You'll see, for example, in the third entry down in the health promotion box, we have a goal getter program. We do a lot of population-based programs, and so this one was new for us. We wanted to establish something more on an individual level. So the goal getter, with the goal getter program, the employee selects a goal from the ones that we've created and give them a choice of, and then throughout the program, they complete activities to hopefully assist them in meeting that goal. And at the end of the program, they're going to come back to us and fill out some information that lets us know, did I work towards my goal? Did I complete my goal? So again, we awarded a lot of points to that one. That was really the first time we're shifting to a really primary individualized program because we wanted the focus to be on the individual. We have enough population-based programs. You'll see some of the other point getters in our fitness category. We have on-site fitness centers in our two largest locations, Cleveland and Toledo. We're very happy with our fitness center staff that we use. We work with them to create programs for employees. We want employees to know that we feel physical activity and fitness is an important component. If you look over to the healthy culture and the healthy environment category, I want to point out some things there. We are a tobacco-free company. We do not hire smokers. We have implemented a smoking surcharge. Some of the other things that we do in the healthy environment and culture, I want to point out is that we have coordinated wellness into the orientation sessions for every new employee. So at that first orientation session, there is a wellness component to it. They get tons of information on the wellness program. HR, we used to join those sessions and talk about the wellness programs, but we can't be at every single one. So we have trained HR in what we want employees to know. And then once the employee is here, we send them a welcome email that tells them some important points, like, go out and do the health assessment. You've got to get that done within your first 90 days. And that's been very well received. So I encourage any of you who haven't thought in that direction to consider that right away in orientation, kind of integrate wellness into that and let those new employees know that it is valued by the company and it is a part of your culture. On the healthy cafeteria side, we work with our cafeteria vendor. We only have on-site cafeterias in our two largest locations, but we have implemented what we call a super well meal of the day. So really at a nice reduced price, they come up, they create a healthier meal for us to encourage employees to select that meal. We've held the line on raising any prices on the healthier food items, fresh fruit, salad bar. I happen to be a registered dietitian, so I work closely with our cafeteria vendor to ensure that the healthy choices are a better price for employees. So it's important that we look at all the components that you could possibly fit into that healthy environment and healthy culture. Also, because these activities don't incur points, they're not listed here, but we do offer on-site MAMs annually for our employees. We do give a nice reimbursement for anybody who participated in Weight Watchers. So not only do you get points, but you also get a 70% reimbursement of your costs. We also reimburse for gym memberships. If you are in a location that does not have an on-site gym, we will reimburse you a certain percentage of your gym membership. So this, to me, is an important slide. It helps give an idea of these are the programs we implemented, and it may give you some ideas on how to structure. We are not big on self-report. We try not to implement too many things that are self-report, but of course there will always be some. Our dental visit and preventive care visit is self-reported. Our physical activity cardio log is self-reported, so you input, how many days of the week you exercised and what you did. So we're trying to create a model so that employees, it's usually a data feed from somewhere, so we can really assess the point values. This next slide shows an internal wellness portal or hub that we built. Again, we built it internally so that employees would have a place to access programs and tools and resources, and it's really a central place for employees to get their wellness information. You can see in these tabs across the top the various categories that were listed on the slide before. So if you go to these tabs, you'll find out all the information and programs that are available. You see there's a tip of the week. There's a recipe down here. There's ways to access certain tools. So the advantage here is, it's an employee. We drive the employee to this site to help them monitor their point progress throughout the program, and our team also benefits because of the data that's stored there. So it's a win-win on both sides, and we've gotten a lot of great feedback. We happen to build this internally, but we did vendor this out prior to building internally, so there are some companies out there offering these types of products. And again, for companies that don't have the resources, there are options that, what about a wellness corner on an already established intranet site at your company? There's ways to kind of get wellness out there on a front page, so to speak. So if nothing else, you can kind of have a wellness corner for employees to go to. So that's a little bit about who we are and what we did. So now I'd like to talk about the results that we've received thus far. I do want to tell you that we send our data to the University of Michigan Health Management Research Center. We wanted a very high standard of evaluation, and data integrity was very important to us. So we joined forces with the U of M to take a look at our data. We send them, annual feeds. The first thing we always look at is our participation, and again, any company, keep in mind, at a very high level, you want to look at participation and satisfaction. If you don't have the resources and the manpower to do a very thorough evaluation, or you can't employ the U of M like we do, at a very high level, always look at participation and satisfaction in your programs. So not to belabor this slide, but our participation rates have been good. Overall, we're happy. Of course, we'd always like them higher. We want those 2, 3, and 4-time participants. We want employees to come back year over year and stay engaged in the programs. This slide is really the most important one to me. We used to look at this slide with only 2 results on it. All we used to get is the average annual health care cost increases for participants versus non-participants. But it's a good thing that we no longer have enough employees in the non-participating category to really evaluate in that regard. So now we look at participation based on the intensity versus participants versus non-participants. Now we're looking at participation intensity. So as you can see over there, to the right, the higher the points that the employee accumulates, the lower their average annual health care cost increases have been. And those are pretty clean trend lines for us here. So this was a key, I think, in us being selected for the Koop Award. It's really showing that as we are getting employees to participate and be engaged, and that participation level is driving the changes in the healthcare cost increases. So you can really see the clean lines at, 0 to 200 points, are seeing a $581 increase, and then jumping ahead, our highest point getters who are really participating the most are seeing only a $320 average annual increase. So that, to me, is a really key, important slide for us. I'm sorry, I can't, oh, there it goes. Again, looking at participation as indicated by point values and the influence on lost work days. These trend lines are not as clean, but you can see that as point values go up, we see less lost workday increases. Don't know why that glitches in the 200 to 39.99 point value range. You see that we see an increase in lost workdays. So I don't know, perhaps, could we make the assumption maybe these people are exercising more, working out more, and then getting injured and losing some work days? But that's kind of a stretch. U of M, we sat down and really couldn't come up with something conclusive. So good trend lines on these, but definitely not as clean as the previous slide. Here, again, looking at participation and point values, we looked at risk status for 2 time periods. And you'll see that when you have a low risk time 1 and you stay low risk time 2, you're seeing the average point values that person has accumulated. So again, some pretty clean trends here, except at the bottom, but you'll notice that as you move from low risk status to a higher risk status, those people were not participating as intensely as the ones who stayed low risk from the time 1 status. So again, if you were medium risk time 1 and went down to a lower risk status, here's the amount of intensity they were participating versus the lower amount in the people that went to a higher risk level. So, in conclusion and in general, our program participation is high, cumulatively at 98%, and our repeat participation is good, 94% of our employees participating at least 2 years in the 05 through 09. Currently, our data is at U of M for our newest round in analysis, so we're very curious to see if we're going to be consistent again. We should get that back from them in a month or 2. Strong correlation, again, between participation and the average annual healthcare cost increases, and then a correlation not as clean between participation and then moving to a state of lower risk from time 1 to time 2. Now I'd like to look at and show you our risk analysis and some of our economic results. Again, it's all about the risk and cost relationship that I'm sure we've all heard so much about. Our goal is always to grow our low-risk population. So you can see in this slide, we're making progress. It's not a quick jump, but we're very happy if we see 1 or 2 percentage points in that low-risk population over the study periods. We're happy. So we've gone from a 61.1% to a 68%. We really want to keep growing that low-risk population. It seems as though we're pulling them clearly from the medium and high-risk categories. So again, very happy about that. As you all know, cost follows risk, and so if we can keep growing that low-risk population, our program will continue to be successful and do what we've designed it to do. So where are our risks for our population? We look at D. Eddington's typical 14 risk factors that he always looks at. As you can see at the top of the chart, we're making strides, and we have some decreases in the risks for physical activity, safety belt use, life satisfaction. So we're making progress in those areas with our employees. However, if you look to the bottom of the chart, we are not doing as well in the areas of cholesterol, blood pressure, and BMI as risks for our employees. So that's clearly where we're targeting our interventions. In the area of blood pressure, for example, we used to, we do the annual on-site screenings. We now do quarterly blood pressure screenings. That we give points for because we want our employees to come down quarterly, have that blood pressure checked, talk to the clinicians who are taking it. They provide educational materials, and it's been more consistent. So we're going to wait to see this year's screening results to see if we're making some strides there. We also then, are thinking about, as long as they're coming down to have their blood pressure taken quarterly, on-site will also take weights if we can get the employees to do that as well. Kind of a reminder and educational opportunities on those two areas because we're seeing the risk increase instead of decrease. And I know BMI and weight across the whole population is an issue and clearly one of the most challenging for any company. So I encourage you, watch your aggregate HA results for your employee population and study them over time, year-to-year analysis, and see where you're moving and see where you should keep directing, your initiatives. This chart also gives us an opportunity to look again at the cost-risk relationship that we all, hear about, read so much about, adhere to. So if you look here on the left-hand side, in the first study period, we looked at our healthcare costs, and we looked at the changes in those costs then if a person moved in their risk status and risk category. So those who are medium and high risk, if they stayed there or say they were medium and moved to high risk, cost us about a $2,200 figure. If you were at high risk and moved down, we saw a decrease of $1,500 approximately. On the opposite side of the spectrum here, our low-risk population were costing us a baseline of, or at that time in that study period, about $2,800. If you moved from low to high risk, look at the jump in cost for us at $34.35 here. So clearly, that's the reason, and we read so much about it, but it really came true in our numbers and in our data. You often hear that the research shows that the cost increases, when groups of employees move from low risk to high risk, are much greater than the decrease in costs that are going to occur when your group moves from high risk to lower risk. So clearly, the economic benefit is greater when your programs keep the healthy people healthy versus always trying to bring those high-risk people down to a state of lower risk. So keep in mind the economic benefit, and clearly it's shown here in our actual results. So that was very interesting for us to see. If our employees are moving from low risk to high risk, it's costing us quite a bit of money in their health care costs. It's costing us when you are high risk and stay or move to higher risk, but you can clearly see the numbers there. This slide again shows our data on the excess medical costs due to the excess risk status that we're seeing in our employees. So with a baseline cost that the U of M established for us, for somebody with no risk or low risk at about $3,500, say, you can clearly see, and this is our actual cost data, how the excess costs come in as the risk goes up. So as when we see people in the medium risk category, we're seeing an extra cost of $3,500, and then take a look at that high risk category, an additional $9,000. Again, in the same regard, looking at lost work days due to the excess risk, this should say lost days, base lost days and excess lost days, but again, clearly you see the trend, low risk, an average of 1.8 lost days, or no risk, I should say, and then you'll see the jumps as the risk categories come into play. Here, still looking at our economic data and our costs, another view of the data. this one was really interesting in that, again, when you look at your risk status time 1 and how our employees moved, and then when you take a look at the average cost, especially in the last column, 05 to 09, clearly you see the trending go up there. So if you were at low risk and stayed low risk, you were costing us in healthcare costs, our payout was about $2,700, and go down that column and you see the trending, the increase. As the risk goes up, our costs that we paid out in healthcare costs clearly went up. Then when you start into this category, you'll see the trending go up again. So we're going from $3,100 to $4,000 to almost $5,000 in the trending, and then again in the high risk category. So clearly, you see how the numbers go up, and you can also see how much more we're paying out in healthcare costs for those in the higher risk levels. Take a look at this row versus this one. So it's very interesting to see your own data in this kind of analysis, because everything you read sometimes comes to true, fruition. At least it did for us. Again, in the same respect, looking at lost workdays in relation to the risk status. So again, you see the same kind of trending there. If you're low risk at time 1, and then time 2, you're seeing how the average lost workdays clearly go up. As risks go up, the lost workdays are going up as well. And again, take a look at this line across versus this one for the people in the higher risk categories. We were fortunate to get, this was an interesting look for us on excess costs by risk condition, so it really pushed U of M to try to come back to us with something like this. This was a look at do the different disease states and risk factors add in excess costs. Again, costs may not follow the risks immediately, but inevitably they're out there, and you may be surprised at, and again, this was for our employee population, so you can see the at-risk column, the not at-risk. The at-risk column, for example, in the first entry, hypertension, so the $37.33 was the cost for those who have hypertension. The next column where it says not at risk was the cost for our employees who do not have hypertension. And then when you see the last column of the excess costs, you may be surprised at some of the numbers, but again, we all know probably somebody with the more chronic conditions will incur, an excess cost more significantly than the others. If you look at the excess cost for our own employees who have diabetes, certainly was much higher than those who have a high cholesterol level. And again, smoking, we all know the health effects of smoking and the costs that are incurred in smoking, but a lot of times it depends on the age of the person, the number of years smoking. So the smoking impact on costs sometimes isn't realized till down the line. So to see that $88 value certainly doesn't diminish what we know the health impact and the cost impact of smoking to be. These were our own employee results. So in looking, we wanted to study further specific relationships. So we were able to take a more in-depth look at BMI and how it affected our lost work days and our health care costs. I mean, we all know that obesity, we see the data and the research saying that obesity, costs an organization and does have an impact, but we wanted to see for our own employees. So again, looking at lost work days, you see that as the BMI goes up into the obese category, we definitely saw an increase in lost work days, specifically for our employee population. BMI then, in regards to our health care costs, again, as BMI went up into the obese category, we saw some significant increases in our health care costs. So in our case, we don't just speculate, do obese employees cost more? We really saw that for us, they do. So when we see this data, we thought, all right, what can we do as far as a BMI initiative? What can we roll out that employees would want to take part in? So we developed, all the weight loss challenges and super loser challenges that are popular, but we initiated a challenge, but we wanted it not only to be a weight loss, but also wanted to term it as a get healthier challenge, so to speak. Our CEO jumped on board and took ownership of this project and this program with his full endorsement. And I will tell you, I've been in wellness a long time, and you always hear that, if you get the CEO involved, you're going to get buy-in. For us, it was absolutely textbook. We had over 1,400 employees participate. If this had been run out of the wellness area, I can pretty much guarantee you that we probably would not have had the participation that we did. We did give points for it. We did want employees to participate. So you'll see all the memos came from our CEO. We even had our graphics department develop, a caricature. We had things logoed. He was fully involved. He initiated a blog about his struggles with, gaining weight actually when taking the CEO position, what his struggles were, how he tries to eat healthy if he's traveling. And that was really a big plus for us. Employees are really interested to hear in what he had to say. We also had a community involvement with this, in that we had a beginning weigh-in, a midpoint weigh-in, and then a final weigh-in. And we wanted to keep employees engaged, so to encourage them to come to the midpoint weigh-in, we had said that we were donating to the food bank. We established a certain amount that if employees lost a certain amount, we would match, that the company would match it in a financial donation to the Cleveland Food Bank. So that really, I think, was a nice component. So I encourage you to think about those things. Any way you can bring the community involved, bring them into your challenge or into your program if you can. That really prompted a lot of employees to want to participate and to come to that midpoint weigh-in. Because the more of us that showed up for that midpoint weigh-in and the more pounds we documented were lost, then the greater the donation was to that organization. So that was a big push for us. We instituted monthly educational programs throughout this challenge. We sent monthly tips electronically via email to all the employees, words of encouragement, provided information on a different topic about exercise, eating well. And again, we truly encourage those employees who may not need it to lose weight to also join in the program to get tips on getting healthier overall. So this program ran last year from January to July. We wanted to see what would happen after the 6-month program. When the program ended, our employees came back again this January of 11, and I just did a whole analysis on the data. Clearly, the 6 months during the challenge, we had a greater amount of weight loss, a greater percentage of weight loss. We did have employees that came back and maintained after the challenge in that time period when they came back again for their screenings. So clearly, when you institute an organized, structured program, I think you're naturally going to get a lot of buy-in. But what we did when this challenge ended in the following 6 months, we instituted a maintain campaign, we called it. Again, putting out some educational pieces and encourage employees to maintain that weight loss that they may have achieved. So 2-time period study, it was very interesting. Again, we got employees lost weight after the challenge, but not at the same level that they did during that structured program. Again, we're always trying to think in terms, because we know BMI and weight is an issue and the most challenging one. We keep all of these things on our list and in our program structure. We do lunch and learn seminars. One thing I wanted to point out that has really worked well for us is what we call our education modules. So we look at the risk issues for our employees, and then we develop modules for them to read and answer a quiz. When they answer the quiz and get 9 out of 10 correct or 8 out of 10, we award points. So, for example, blood pressure, hypertension is an issue for us, so we'll do an educational module just about every year on hypertension. It's about a page and a half of text that the employees, we write them in our area, develop the text, give them some good resources, handouts, they answer a quiz, and they get points. We did it specifically for seatbelt use because that was an issue for our employees. Our employees were not wearing seatbelts, so we developed an educational module really hitting home on why you should wear them, the statistics around wearing seatbelts, and we really saw a jump in the use of seatbelts. So those educational modules and that type of strategy really has been working well for us. Then we do some benchmarking to see how we're doing against all the national standards. We look at the HERO scorecard. For any of you that haven't seen this, I encourage you to go out and look at it. There is a lot of value, I think, in looking at the scorecard and scoring yourself or submitting it to be scored, in that it gives you a nice inventory list of these are things our organization should be shooting for and should be doing if we're trying to move towards that true health and productivity model that's going to get us some outcomes and get us some good results. So every year we sit down and take a look at how we're scoring, what are we doing, how can we improve. So I encourage all of you to do that. It is a great tool. If nothing else, it gives you ideas on program components that you should be implementing and you should be considering as part of a really strategic integrated model. We look at NBGH's scorecard also, again, looking at ways, how can we improve our points? Where are we missing? Is it the engagement level? Is it the outcomes and analysis level? And so that kind of motivates us to try to always look at our program and see where we can tweak it and make it better. I made it a point to tell you we don't run our program out of HR. However, HR sends a general survey out to our employees. We asked them several years ago to include some questions on wellness because we knew all employees would be hit up with this HR overall company survey, and they get great response rates on it. So 94% of employees, the survey, they always share that with us, 94% of employees surveys feel that the wellness program is making a positive impact on our culture, and also the majority are saying that it's making a positive impact on their health. So we do watch those things. We also do our own wellness area survey as well. We want to ask employees every year, what did you like? What didn't you think is, worked very well this year on the wellness programs? How do you want to be communicated with? So we really, our employees are very vocal here and are always willing to give us feedback. So we take that. It's interesting to see the majority want to be contacted, for the most part, by email with program information. So we look at that. 82% said that they were very satisfied with our wellness program. So overall, our executive summary is just showing that we're seeing some, we're definitely seeing some positive impact on our healthcare cost trends for the last 3 consecutive study periods. We continue to grow our low-risk population, and for us, that's really a key achievement and what we're striving for. As employees are earning more rewards points, they're having smaller healthcare cost increases and smaller lost workday increases overall, and in general, an increased participation level was associated with an increase in the percentage of individuals at low risk. And we again look at the percent risk reduction. Where are we reducing risk? Where is risk really not moving for us? So we're going to continue to work on BMI and blood pressure, and now even elevated cholesterol. And again, when you look at the take a look at your demographics. Is your employee base is just at that age where they're starting to move into the borderline areas for blood pressure and cholesterol. What are the issues? How can we help them, stay at that level? Again, we agree with Dee on just don't get worse philosophy. So we continue to look at that. I just included a slide on where we think and where many people think wellness is going in the next practices. I do think that we need to, we all implement and we look at wellness on a population basis, but I think we need to focus on the individual and really help them impact their personal buy-in and help create some personal significance of making a change in their health status. This has got to be sustainable. They've got to look at health in the context of their life. You see, now we're seeing the advent of the well-being index. So we're looking at health in the total picture of their life and well-being. And I think in order to make wellness successful, you've got to get people to attach that personal significance to it. What is it that's going to drive you or me to live a healthier lifestyle or to add some meaning to wellness? Until we get to that point, you will get people to buy in as we're moving to results-based programming out there, but again, on a personal level, we've got to touch people. I think, moving the general public to healthier lifestyles is going to continue to happen, and organizations are going to continue to strive for the public movement. You'll see more of an increased role in the community, in employee and family health, the employer involvement in, again, the community and how we can outreach, because, again, if you impact the employee at work and send them back out to the community where there is not an atmosphere, an environment to be healthy, then a lot of times that behavior change does not continue or sustain itself. Health needs to be a social trend and a social movement, I think, in order to be successful. Just like this may not be the best analogy, but the whole recycling movement. You notice that, nowadays it's standard practice to recycle. We don't think about that and think about, how we've educated our schools and our children into the recycling movement. Health and getting healthier has got to have that momentum now. Number 3, I do think we need to standardize. We need to have some standardization of the program offerings so that we can really evaluate and get some good performance metrics across different employee populations. And again, there will, I believe, continue to be a focus on the influence and the impact of corporate culture. If your culture isn't conducive to wellness, then again, your programs can't be as successful as you'd like them to be. Okay, that's pretty much my presentation. Don't know if you want to open it up to questions.
Thanks, Connie. That was great. Yep, got some questions. Let's see. I guess here is one. Shar wondered if there is a point range incentive piece into the point system, within the point system.
Oh, I'm sorry. Oh, I really apologize. Yes, that I did want to tell you that. Our point system, our incentive structure is designed so that employees receive a premium discount or contribution to their HSA accounts. If you are not if you are an employee that does not elect our coverage, then we give gift cards. So our point structure is such that if you do the you do the health assessment only, your incentive amount is $100. If you do the health assessment and come to our annual health screenings, your incentive amount is $150. And then from there on in, it's a point accumulation. So a certain point level gets you then $200, and then our top incentive amount is $300 for a certain point. You need our points go up to a possible, I don't know, 2,400, whatever. But if you accumulate 1,500 points, you're at the top, platinum level. So again, point structure, and then we years ago. Here's a little history on what we did, points and incentive structure. we used to offer only gifts, like we had a shopping basket full of wellness-related gifts that the employees would cash in their points, so to speak, at the end of our wellness year period. So we moved that to premium reductions, and then we got rid of everything but premium reductions. And we saw a drop in participation because the employees came back to us. They were very vocal that said, I worked hard for this reward, and even though it's 6 of one, half dozen of the other, I want that money in my hand as a gift card versus you giving me a premium reduction. I don't want that, so we had to change our program around. And then we continued to go down the path of it would be just for covered employees a premium reduction or HSA contribution, and they really spoke out again and said, give me the option. So we fought back a little bit on the wellness side because we really want employees to understand that their health behaviors really influence their health care costs. So we're going again to health care premium reductions, HSA contributions, and gift cards are available to the non-covered employees. So I apologize, I forgot to add that piece in. That yes, we incent. So our top incentive amount that you can earn is $300.
I see. Okay, super. Well, that answers that question. Let's see. Somebody had a question regarding the healthy vending. Was there pushback from employees? Did you have trouble finding a vendor that was willing to alter the prices on, the regular junk versus
no pushback at all from employees because we designed the vending plan to be, I believe it's maybe 60%, 60-70% are healthier choices. So there are still a few choices that you would consider not to be in the healthiest category. So they do have some choice, but the majority of selections in the vending machines are healthy. We did not receive any pushback, nor, and again, the vendor that our food service vendor does our on-site cafeterias and our vending definitely has those options available.
Awesome. Okay. Let's see. Another person saying, "Great job." I certainly second that, and I love it when the phone rings. I apologize. Were there any major obstacles during the process, and if so, how did you overcome them? That was asked.
During the what process?
During the process of setting up this program, and
I wouldn't say there were any major obstacles. I would say the issue of the gift card versus the premium reduction was one that employees really pushed back on, and we were surprised about. But here was the issue for us. When one year we saw a drop in participation, we thought, our goal is to get employees engaged so we can impact, their well-being, their health risk, the cost to the organization, everything that you design a wellness program for. So, if they want the gift cards, as much as we believe it should all, be geared towards the incentive implemented in premium reduction, we'll give them the gift cards if that's what they're saying they really want to have. If it stops you from participating, then we're certainly going to give it to them. Mm-hmm. In fact, I'll tell you, we have open house meetings that our CEO does every so often throughout the year, and it's an open forum at the end where he takes questions, and at the last one, the one before the last one, an employee stood up and said, I think we should be able to get gift cards. And so he looked at us and said, okay, you guys, change it around and let them have gift cards. So that was one of our biggest ones, surprisingly, the pushback. Not a lot, because again, as you see, the lineup of things you can participate in is pretty varied, and we tried to hit all the areas so that everyone can find something they're interested in doing. So we really haven't gotten a lot. And when we did, I think we're pretty generous about doing things for the employees. Whenever we can, we'll do little, giveaways, and, the annual Employee Health and Fitness Day, we do an annual walk, and we give employees a T-shirt. Most of them come to get the T-shirt, and, to do the 1 mile walk with us in May. But I honestly can say, I'm not saying our program is perfect, but we just haven't had a whole lot of pushback.
Well, you can't complain about that. Let's see. Shar also wondered, do you use an online program to allow employees to track their points?
Right, that portal page that I showed you, when you go, there is a tab you can go to there where you have a listing of all the programs, and if you've earned the points, they show up there. So, and then in the corner of that page, you'll see your total points. So that really helps employees. It helps them. It helps their frustration levels in knowing where am I at, how many more points do I need, those kinds of issues. So that has been helpful to us.
Steve wants to know regarding your BMI initiative. What percentage of your employees gained back, 5 pounds after the competition, or did most manage to maintain it? How did that work?
Oh, I don't. We do. I just got that document back. I don't have those off the top of my head, but I want to say in the second time period, I want to say, well, first of all, I do have to say there was a subset. All we could do is study the employees who participated in the Chiricahua Challenge and who returned for the screening the following January. So that knocked down a portion of our employee population. So I believe there was about 1,000 people, 1,000 employees in that study then. I don't want to venture a guess. If there was any way I could get back to him, I want to say maybe 40% gains. But I could be totally wrong because there was so much data in that analysis. I wish I had it with me.
That's all right. You didn't know that we were going to ask such hard questions. Now, is your program available to just employees, spouses, families? How does that? I remember
we have not rolled a lot out to spouses. For several years, we incented spouses to do the health assessment with a $75 gift card. It was a $50 gift card one year, $75 gift card another year, and we then stopped that. We just haven't rolled a lot out to employees, to spouses and families, just because of the logistics of it for us with all our locations. But it's something we always consider it. We are considering, trying to see how we can pull that back in, because again, ours is not a new program. We've been out there at it for quite a while, so a lot of programs will start out with the employee, and then move it eventually to the spouse and family, and we're definitely at that point, but we just haven't done it yet.
Yeah, it's always evolving.
We were hoping that having the spouses do the health risk assessment online, would impact maybe their utilization of health care or, impact their health risk status, but we really couldn't see that in the short amount that we did incent them to do the health assessment.
So are all the health risk assessments administered online?
It is online. All our employees want to do it online. We do have a paper option, however, available.
Okay, well, great. Well, there's really good questions, you guys, and I didn't even encourage you to ask questions. You're getting with the program. I love that. And Connie, thank you so much. This was great.
Oh, you're so welcome, and thank you to everyone. Really, again, I understand how busy everyone is, so I really appreciate you being here.
Well, I really appreciate you taking the time to share the information with us. And this has been recorded. It'll be available on Health Promotion Live under the Koop Award tab next month. Gosh darn it, I cannot think off the top of my head who we have. So they'll have, big shoes to fill after you, Connie.
Oh, thank you.
Thanks so much, everyone. Have a great day.
Thank you.
I'll see you soon. Bye-bye.
Bye.